In 2019, Congress, with bipartisan support, passed a bill that forces hospitals to be transparent about procedure costs, publishing them on their website.
And as ABC 7's David Furtado reports, it could change how we look at health care.
They say healthcare, unlike any other service, shows you the cost after services are performed, but not anymore.
Now there is a federal regulation that requires them to not just give you a price, but to post it in a friendly, readable manner.
A big change for hospitals starting at the turn of the year. Prices for 300 procedures must be posted on their website. 70 of them predetermined services such as office visits, lab work, radiology, and surgeries.
Things that are pretty standard and easily shoppable.
Josh Butler, president of Butler Benefit, says the other 230 can be chosen by the hospitals, but having the data accessible to consumers, Butler adds, allows them to shop for the best price. And with high deductible insurance plans, folks might find a cheaper way.
What a lot of times you find is their cash price that they offer people is lower than the negotiated price through insurance.
And the rule opens the door to competition, says Butler.
They can also compare different facilities, like what's it going to cost me at this hospital versus what it's going to cost me with this hospital, because they take my insurance too. They're in network.
But this level of transparency almost didn't happen. The American Hospital Association filing a lawsuit in 2019 when the legislation was being discussed.
They say that this regulation imposes significant burdens on hospitals at a time when resources are stretched thin and need to be devoted to patient care. Okay, point taken, but here's my opinion. We have to look at the whole patient, and that includes their financial stability, their financial capability, and things of that nature.
Butler says this is a good first step to increase transparency within the healthcare system, but he adds the next change could be easily accessible consumer-friendly data that looks at quality, because
oftentimes we see that, a correlation between cost and quality. Where we see lower costs, we see higher quality metrics. Where we see higher costs, we see lower quality.
For ABC 7 News, I'm David Furtado.
And Butler says the penalty for not complying with the transparency rule is $300 a day. With healthcare transparency receiving bipartisan support, these new rules could stick around after the transition in the White House.